Is water birth safe?
So let's talk about hydrotherapy. So that's getting down in water for either labor and or the birth. And so a lot of hospitals and birthing centers now do have labor tubs. Some of the hospitals even have like the inflatable tubs that they can roll into the room and blow up. And then of course the liner is changed out with every patient to make it hygienic and clean and all of that. But it's really beginning to be more popular because in the research there's a lot of advantages. So getting down into the labor tub can really help mom feel more relaxed and more comfortable. It actually decreases pain and it is very safe for low risk women, especially. Now, if a mom does have to have continuous electronic fetal monitoring, then that's going to depend on what else is going on with her and according to the policy of the hospital to see if she would qualify to get down into a labor tub. And there again, if you remember the fetal monitoring options, there are some that are water resistant. And so it's going to depend on the availability of that type thing. But for a low risk mom, it's going to be a really great advantage. Hi, I'm Susan White, certified nurse midwife with Childbirth Education for the Christian Family, and I want you to be informed so you can feel empowered in birth. Please stay till the end, and I have a free resource to give you. And also, please click like and subscribe if you're finding this helpful. Then water birth is actually giving birth underwater. Now, that's not yet supported by the American College of OBGYNs, so it's really not available in most hospitals, although I am hearing of it kind of popping up here and there with nurse midwives, possibly in a hospital setting. But the American College of Nurse Midwives has found that low risk women should be able to give birth actually underwater because the outcomes are just as good if the mom is low risk. And then I found a recent study where they looked at the benefits of water birth. And what they found is those women had less prolonged first and second stage labor. So that means they had a shorter labor. They had less problems with an abnormal fetal heart rate. They had less problems with mom having lacerations. And then also they found that actually the babies did better and there was less risk of babies having to go to NICU. And so there's getting to be more and more advantages of actually giving birth underwater. But there again, that's going to depend on your provider and where you're having your baby, whether at home or in a facility. Would you like to have a free copy of my resource should you have your labor induced? And also save a discount on my childbirth education classes? Just go to the link in the description. And next, I'd like you to check out my video on fetal monitoring and know your options. Thanks.